All right, folks, this is Dick Hartzell. He's down here at Westside Barbell, and he's going to demonstrate some stretching with the jump stretch bands. He is actually the inventor of the jump stretch bands and the platform. I want him to come in because I'm no expert on stretching, and Dick is. So let's get Dick going and find out how to stretch.
Thank you. And I am not a doctor or a physical therapist. I teach doctors and physical therapists in reference to rehab. I see everything from a sprained ankle to a heart transplant. So some of the things on this tape will be in the rehab area, and it'll give you a whole bunch of ideas in reference to getting rid of pain. I do work with Dr. Bill Kramer out of Ball State University, one of the top research guys in the world. I work with Dr. Mike Gaudios, family and sports medicine physician out of Chambersburg, Dr. Mike Schimmel, a chiropractor out of Stowe, and Larry Kasinga, the head of physical therapy at St. Elizabeth Hospital. So I have a lot of medical people that I consult with when I do things. In reference to protecting your ankles on the front side, and I'm only going to do one ankle. I'll show you how to get in and out of it. Both ankles need to be done. In reference to getting into the bands, we sit down on the floor. The band comes over the top, around the waist. The easiest way to operate with this band is to get your knee out of the way, put the band around the arch of the foot, twist it over the toe. Just take it and twist it right over the toe. Put the foot out, turn the ankle in and out, and loosen up a little bit. Try to keep the toes straight up and down. The key to protecting your ankles is eversion, inversion. We turn in, that's 75 pounds of pressure. When we squeeze out, we isolate the perineal muscles on the side of the leg. So we're going to squeeze the ankle in as far as it'll go, we're going to squeeze out. The strength is built on the outer movement. The balance is taught on the in movement. So it's squeeze, squeeze. We would go 1, 2, as far as it'll go, in and out, through 10, 15, or 20. Pull to the outside. Squeeze the ankle out as far as it'll go. Drive it in as far as it'll go. 1, 2, through 10, 15, or 20. Take your outside hand, push in past the knee, bring the foot back, squeeze the band here, stretch it, that opens the circle. Use your thumb and index finger to move that band up around the ball of the foot. When you position the band on the ball of the foot now, you're going to push down, which hits the gastrocnemius. You're going to pull up, which isolates the tibialis anterior. So as you, and if the band slips off, and that's a good thing, I'm glad it did, just readjust, put it back on, push down, pull back, push down. Gastrocnemius, tibialis anterior. Take the band and pull above the knee. As you bend the knee and stretch back, placing the heel on the floor, you isolate the soleus muscle and the Achilles tendon. The further back the band comes, the more stress and the more pressure on the Achilles tendon. So you want to pull the foot up, push down. Your right hand holds the band in place. Your left hand just sits there on your knee, which keeps this nice and smooth from here. Put the leg out straight. To transfer to the other foot, you simply push in, bring the foot back, stretch the band, open the circle, bring the other foot back, position it down around the arch of the foot, and carry on with your exercises. In order to get out of this and go right into your stretching program, the hands come together. They go down through the band up to the elbows. The right hand goes in, the knee goes out, the foot comes back. Duck the head, lean forward, push up, and the band slides off. What we're going to do right now is we're going to take a little break. I'm going to come back, and we're going to traction an ankle. In reference to taking care of ankle injuries, and our humble assessment again now, we're going against some of the traditional things of ice, elevation, and rest. We would go immediately to traction in order to distract this joint, get the pressure off of it, keep the blood flow in the joint, which causes healing, and will also help to hold the swelling down on the joint. Truthfully, with ice, you're not going to reduce the swelling anyway, because by the time the guy sprained his ankle, you already have the swelling before you get to the ice. So where we're going to go with these ankles, and I don't care if it's a new sprain, an old sprain, or a sprain within 24 hours, traction the joint and you will reduce the downtime, and you will get the athlete on their feet much faster. So what I'm going to demonstrate is the technique on how to hook this up. This is a continuous band. It's called a mini band. Now we'll get a little closer shot here where you can see the band come in. It goes in under the foot, comes out the side, back through the loop on this side. Now, that band is now locked in around the ankle. I'm going to take one side of the band, pull it down underneath. So now part of this band is behind the heel, part of it is under the arch of the foot. The band should not be on the Achilles tendon. Two areas that you can run into trouble. Number one, if someone has a screw in their foot, which I ran into this when I went to traction a football player at Toledo University. He had a screw in the top of his foot. That hurts around the arch of the foot. Just move it down so that it's not on the screw, and that relieves the pressure. That basically is the only thing that you bump into in reference to problems in tractioning a joint. The next thing that we'll do here is take the other band, loop it around the foot, back out the other side, go to the back side, and just juggle it around till it's snug on the foot. Reach up on the back side, pull this down under, and you're ready for traction. Now, if this individual is in severe pain, all you do is sit down on the floor, and you're better off on the floor than you are on a training table, because on a training table, sometimes you have a tendency to pull them off the table. In reference to grasping the band, put the hand up through the band and grab a hold of it. If you grab it this way here, what happens is your hands get tired ahead of tractioning the joint. We take the other hand up through the band, grasp it, and pull out. Now we ask the athlete to pull the foot up and down. So we're going to do dorsiplantar flexion. The toe goes down, the toe goes up. When they go up, they're going to bump into pain. The key is to get them out of pain. So push back down. They'll bump into pain there. Go back up. So you're going in and out of trying to get rid of pain. Turn the ankle in and out. Now we're going to twist it in and out. We go eversion, inversion, and we're tractioning this joint apart. The next area that we'll go into immediately, if you grasp that band over there, we're going to wrap this around now, around the foot, which allows us to get into weight bearing. And the time periods are 3 to 5 minutes. It depends on what the athlete's able to handle. What I will do here is pull on the band, distract the joint. The athlete pulls on the band that way, pushes down, pulls up, push down, pull up, turn the ankle in and out. This gives you a real quick idea on some things that will really help in reference to the ankle. We're going to take a break here and then go right into the stretching program. In reference to changing hamstring flexibility, one of the keys is to get plenty of pressure in behind the knee. So we're going to take the band, wrap it around the arch of the foot. We'll have the athlete lay back on the floor, both legs are straight, the toes up. We'll grasp the band, one hand on each side. We're going to pull the leg up and let off, pull up a little higher and let off. The key in changing hamstring flexibility is to go in behind the knee. The leg may start down here. It doesn't matter. Go to wherever the individual is. Bring the band up here now to start changing hamstring flexibility. Bend and squeeze. Lock the knee out. Keep the toe up and drive it up and squeeze. You'll get discomfort or pain in behind the knee. If it's too much, lower the leg. After a period of time, those muscles will adjust to this pressure. Bend and squeeze, bend and squeeze, bend and squeeze. They get trained so that they don't feel the pain, and that's why I can take my leg up here and apply the pressure, push and squeeze. This also helps to stabilize the knee on the back side. In reference to the inside, we bend the opposite knee, kick the leg outside, grasp the band with the right hand over the head, drive out, push and squeeze, stabilizes the knee on the inside. For more pressure, simply bend the knee, take the band, stretch it all the way out, and push out. Bend and squeeze, bend and squeeze. Drive the leg straight up, heavy pressure on the hamstring. To hit the iliotibial band, you take the band, same hand, same foot, slide the band over the head, stretch it out, and drive cross body. Bend and squeeze, try to keep both shoulders on the floor. drive the leg up and squeeze. If it's too much pressure, let off on it and go cross body. Drive the leg up. To stretch the quadriceps, take the band in the right hand, roll onto the knee, make sure it comes off of the heel, hold the band over the shoulder. Extend the hands forward, bring the knee off of the floor and keep the leg straight, don't reach to the outside. Bring the knee up once or twice, kick the leg down, bring the leg up, you go right into the hip flexors. Roll on the side, bend the knee, drive up, reach back, move the leg any place you want to move it and stretch. To get real good work on the quads, extend the leg down, kick it right down behind your butt, bring the leg up and reach back. This will do a nice job in reference to the quadriceps. Set up, and we're going to take a little break. We'll come right back and go into low back. In reference to back pain, 90 to 95% of all back pain is skeletal muscular. In other words, you got a spasm in your low back, and the key to getting rid of it is movement. Rest is for the deceased. So we're not going to get into sitting down and resting or taking pain pills or anything along that line. We'll make the initial move to correct the problem ourselves. If that doesn't work, then we will seek professional medical help. But the key with the low back is activity. We'll take the band in around behind the back, slide the right hand through the band, pull it up on the knee. If you have on shorts, it pulls the hair a little bit. I won't feel it, so carry on. Slide the hands back, arch the back, round the back, arch, move the legs to one side, move to the other side. Any type of movement that you can do, and you can do this sitting on the chair and or on the floor. On the floor, we'll go onto the back, bring the knees up and stretch, put the feet on the floor and push. This is an awesome traction down through the low back. Move your hips around when you're down here. Squirm around a little bit, move a little bit, bring the knees up and stretch, push and stretch, move the hips around. Grab the band on the side, drive the right hip off the floor, put it down, left hip off the floor, tilt your hips, drive up, drive your hips off the floor. The stronger your butt, the better your low back. Bring the knees up and stretch, roll to the side, take the underhand, pull up, push down, pull across, go back across, same thing on the other side. Push down and pull across. We use this as a warm-up program and as a way to attack back pain. We'll take a little break and come right back. Another method for attacking back pain, which works outstanding, again, everything that I talk about is going to be traction, traction, traction. You take the band here, hook it on the crossbar extension, slide it onto the other side, bring the feet back onto the board, the hands are on the far side of the board, push the board away, the feet have to stay on the board. As you push with your arms, this tractions your low back and relieves the pressure, takes pressure off. Tilt one side, tilt the other side, drive both hips up, put them down. You can work down in through here any place you want to. You want to, after you've done this 10, 15, or 20 times, grasp the band in the center, turn over onto the stomach, put the hands in the center of the board. As you push up, drive the knee onto the board, bring the hands forward. You're going to arch the back and around the back. Anyone with back pain will come into this activity and find tremendous relief. You want to move in every direction that you possibly can in through here. Arch the back, arch, you got arch and round, arch and round. Don't bend your elbows, stay up in here. All you're trying to do is move your hips back and forth, get in and out of the pain. We'll take a little break and we'll come right back. In reference to some other activities that you can do to attack back pain, this is what we call a vertical back traction station. It's two pair of strong bands interlocked and hooked up at, this is at approximately a 7-foot level. 8-foot level would work just a little bit better. In getting into the band, you take one side of the band over the top, put it under the butt, spread the feet, take the other side, put it over top, it goes around the back. Back up, which now allows you to sit down, put your hands forward, and start to move your hips. Regardless of the amount of back pain that you're in, this lift will allow you to move. This stretch will allow you to move. Go up and down, move your hips any place they'll move. Arch your back, round your back, move. Step a foot back, lean and stretch. Step the other foot back, stretch. All you're trying to do is get rid of the back pain. This is a good warm-up and or a way to get rid of pain. We step forward, slide the band down around the belt, go back onto the floor. This will pick you up off of the floor, drive your hips up, go from side to side, reach up, drive down, and move across. From here, we take a foot across the band, bring the other one up, push. This will stretch your low back. Go from one side to the other side, push, stretch, move, and move. We'll slide out of this band here, and we'll come right back with a couple other activities. In reference to stretching and strengthening your low back, it needs to be trained in and out of what's classified a proper range of motion. When we're lifting heavy weight, it's important that we use proper technique. When we're strength training the back, it truthfully needs to be worked out of a proper range of motion, which means we're going to take this band, put it over the head and over the one arm, over and under. Drop back onto the floor, holding on to the band. From here, we extend back, sit up, extend back, and sit up. Now we want to twist to the side, which is classified out of a proper range of motion. Drive down, reach up, drive down, reach up, drive back, and reach up. Now, as far as the lifter goes, you can do this whether you have back pain or not. This is a good stretch and a good strengthening activity. In reference to the shoulder, we can do a lot with distraction or trying to separate this joint to get pressure off of it. Blood flow is a problem to the shoulder. Therefore, tractioning that joint is going to make it stay a little more flexible and function longer for you. If we take the hand, stick it up through the band. A key in grasping this band is, one, make sure that this is not loose. This would be incorrect. The correct way is to make sure that this band is stuck on the hand. Grab it, step out, lean. Spread the feet wide first. Set your butt down, turn your hand over, lean away, and stretch. Just keep leaning and stretching. This tractions the joint and takes pressure off of it. This you ought to work on right after you come off of a lift. That's my humble assessment. Turn, face the pipe, move the shoulder, turn across. This will stretch your upper back. So if you come in through here and just lean, you have your upper back. With your hand on your knee and bend down, you're right into the low back. Switch hands and do the same thing. We'll take a little break and come right back with rotator cuff. In reference to the rotator cuff, when you sustain a rotator cuff injury, the key activities in bringing this thing back. Number one, go to an upright row, and when you get to the top of the lift, pull the band out. You have a nerve going through the AC joint that releases that pressure on that joint. So bring it up and out. This has nothing to do with the rotator cuff. What it does is it builds confidence in the muscles around instead of just trying to take the rotator cuff. A lot of rehab people tell you do internal rotation or go up in here and rotate. That's a waste of time. Go here. Upright row and pull out. Reverse curl. Build the muscles in around this joint. Now when we go to the bench press, and this is a little more direct attack, flip the band over, make sure the thumbs are on the front side. If it's your right shoulder, work the band around, move it to the side, push easy, and push. We're trying to develop confidence in the muscles around the rotator cuff. In reference to the shoulder, and I would come back, I have a light band here. This is a mini band. Take the band in your left hand, flip it over your hand, push the hand through, bend the elbow, drop it down, pull it out. That locks in on the elbow. Now for your rotations, go here. Bring it over the top, behind the back, bring the arm in. This compresses that rotator cuff instead of pulling it apart. Work back in through here, reach back. This is a big deal, back in through here. Take it up over the top, pull down, let your elbow go in any direction you want it to go. Take the band off, drive the arm up, pull out, pull down, and then go right back to your traction. The more tractioning you can do with that rotator cuff problem, the faster it's going to go away. In reference to tractioning an elbow, take the band here, loop it over itself, slide the hand through, and allow this band to lock in around the wrist. The key here now is to step back and don't grasp the band. If you grab it here, you have more help from the shoulder. If you leave your hand open, bring back, reach out. There's the key. Stretch, stretch, and stretch. Now, take a look at the loop here. In reference to the loop, you may step back in here, pull out and say, I don't feel anything, and I'm going to say you're right. Take the loop here now, move it over a little bit. Pull here, and you may say, I don't feel it there. Okay, fine. Move the loop again. Here's the key, is the loop. Make sure this is below your wrist. Pull back up, and you'll hit it right there. You go, wow, that's right on it. So keep going in and out of the area where you have the problem, and this will work with you on the elbow. In reference to the wrist, all we're going to do is move it in and around here. You're tractioning the joint. You're trying to distract that joint. Pull, move, move, and move. And that'll take care of the wrist and the elbow for you. In reference to the hip joint, sometimes we'll come down, they talk about arthritis or different problems in the hip. If you want to get rid of pain in your hip, take the band here. And this goes for the hip replacement, the knee replacement. I'm going to cover all of this stuff. I see it all, and one of the easiest ways to get rid of pain is to take this band, flip it over, put the foot up through the band, take it on the back side, pull part of it down around the foot, just like we did the other time on the ankle traction. Move that up, turn on to the side here, and slide away. So as you slide away, this is pulling your hip, it's distracting the hip. Turn on to the back, bend the knee, reach out. Now this will also work in the knee. So if you want to traction your knee, bend it, pull, turn, keep squirming around, get in different positions until you find something that works. Slide away for more pressure, get bigger bands for more pressure, but keep moving this. If you want to nail your hamstrings, pull down. If you want to nail the quads, turn over and drive up. This will hit quad hip flexor. In reference to getting a range of motion in the knee, and you'll see a lot of rehab people grab a person's leg here, bend it, and pull it up. At best, that's insane. If you would take the knee here, take a band like this, flip it over, bring the foot through the band, and then lock it in on the knee and step this leg forward. This is the absolute easiest way to get a range of motion in someone's leg that has either had surgery, injured, or knee replacement. Allow the band to stretch back. If you want to balance on a bench, go ahead and put it out there. Put this foot forward. There's no weight on this leg. All I'm doing is bending forward, reaching back, and allow that to stretch. You're actually trying to hyperextend the leg, which will then, that's the easiest way to get a range of motion back in the knee after either surgery or injury. You go with your traction, you go with this hyperextension here, and this will give you that range of motion. In reference to your neck, we have a simple harness, one mini band, move your neck around, tilt it back, turn it, move it. This distracts the vertebrae, allows you to get some relief in there from the pressure. If you want more pressure, simply stand up, raise the band up. You can hold on to it here, which pulls down. If you're working at home and you have a doorknob available, just hook it on the doorknob and hang around. Turn, move, turn, tilt, move. And this will help you out to relieve pressure in the neck area. Now, if you want to do this from a horizontal position, you simply take the band off of here, loop it around again. This will go under a door. You close the door and simply lay down on the floor, slide away, and this ends up tractioning your neck in a horizontal position. These different activities that we have demonstrated here will help you out in relieving pain, in improving your flexibility,